Welcome to the City of Newark's Caribbean Commission, where we are using this platform to inform, to engage, to educate, and to even discuss social issues that we can recommend as policies to the city. My name is Esther Lewars, and I am the Public Relations Officer for the City of Newark Caribbean Commission. In studio with me today is Commissioner Bernard Rollins, who's no stranger to you, has been my co-host for the last 3 segments. We also have our expert guest, Dr. Hortensia Kelly, who is the Medical Director for the Community Health and Wellness Department, hopefully I said it correctly. She's also a former commissioner, so we thank you for being here. So today we are going to talk about the topic of mental health.
My name is Dr. Hortensia Kelly. I am the Medical Director for the City of Newark. And one of the programs among many other programs that we bring to the community is that of mental health. We have and we work with providers that are certified to provide those services. And those services are services that, especially after COVID, have increased in an exponential amount in our cities. First of all, I would like to start by defining 2 major mental conditions. The first one is depression, and the second one is anxiety. And I think a lot of the times those two are interchanged. And even when they're manifested as a diagnosis, they could be linked together, but it's good to define the difference between what anxiety is and what depression is. It has been my experience, both personal and professional, that anxiety seems to be a little more prevalent than depression itself. A lot of the times anxiety leads to depression, and a lot of the times depression leads to anxiety. But many studies have been performed where the number of anxiety episodes far outweigh the number of depressive episodes. So depression is just more than feeling down or feeling like I had a bad day today. Depression is when those feelings persist for 6 months to a year. So is it okay for someone that had a death on the family to feel depressed? Yes, that's okay, and that's normal. Right. It would be abnormal not to have those feelings. Our families are able sometimes to.
Right, I was just going to ask.
Our families are able sometimes to figure out that something is not okay, and that's where community, for those of us that are not around family all the time, that really stresses the importance of our community, what we should be doing for each other at many levels, including mental health. Now, going back to the importance of community, Bernard. Community is something that has been attacked for so many generations. First, during the whole slavery trade, then during our establishment here, our communities were under attack. Even when we were building, we had the Oklahoma Wall Street. Those were communities that were being built up even after generations of slavery, and they were again destroyed. And that sequence of that, all those things that happened has really led us to where we are today. So we have our communities that are now beginning to understand the importance of, family, the importance of making sure that our children are receiving appropriate education, making sure that our healthcare industry and our healthcare system, especially in our inner cities, are appropriate, and that we are giving our people the right type of services.
Are you trying to tell us there's some post-traumatic experience.
You could say that. We're suffering from post-traumatic slavery syndrome. And that's something that we, number one, we have to become conscious of that. And then after that, we can then make the correct changes. And notice that I said the correct changes,
Right,
because just because you're
right.
making a change,
Means that
does
you-
that mean that you're making the correct change? And then we also have to understand the importance of certain sacrifices. And are we willing to make them? And are we raising our children with those awareness and that history? So health care, mental health, anxiety, depression are all linked to what happened to us in the past and how we are facing them now and how we will continue to face them in the future. So it's important for these type of conversations to happen. And I am so proud that, that the Caribbean Commission is actually tackling these issues, which are crucial issues to us moving forward as a group of people and as members of society and as society in general.
As I said in the beginning, someone who has actually gone through, mental health challenges, losing loved ones, expectations not meeting where I see them and feeling in that place. We want to let you know that if you are having those feelings, reach out to the City of Newark, Department of Community Health and Wellness. Reach out to the Office of International Relations and Diaspora Affairs. And again, we want to thank Nwk TV for hosting us, the City of Newark for providing the Caribbean Commission as a space that we can have this conversation.